Hi, good morning Fiona. My name is Huston Daniel. I'm your invigilator for the OET speaking session on the 12th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Fiona Jones.
And what is your candidate number, please?
My candidate number is 221142411.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
All right. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
Okay. I got you.
Talk about a conflict that you experienced in a group setting. What exactly was the conflict, and how did you react to it?
During my final semester of coursework, to become a nurse, I was given an intricate group project. During a senior-level anatomy and physiology course, the workload for the project was substantial, and every member was expected to do their part. One of our members wasn't pulling their weight. The conflict was solved with a group meeting, where we re-established responsibilities and due dates.
Talk about a time when you surpassed patient care expectations. What was the situation, and how was that exceptional care provided?
During a clinical, I was given the task of administering flu shots. A 10-year-old boy came in to get his shot, and I could tell he wasn't happy about it. He was visibly tense and nervous about the needle. I prepared his upper arm for the injection, and started joking around with him. I asked him about his favorite sports team and the TV shows he liked. I was able to give him the shot easily, after calming him down with our chat.
Talk about a time when you were under significant pressure to perform a task. How did you get the job done?
This question immediately brings my first clinical to mind. I was tasked with giving an IV to a patient. I had built up a ton of pressure on myself to succeed. After how hard I hit the books, I figured I should be able to give an IV with no trouble at all. Unfortunately, I was having some trouble. The pressure started to get to me, but before the patient could notice my discomfort, I took a deep breath, went over the correct technique in my head, and inserted the IV.
Talk about a time when you were completely overwhelmed by your workload. How did you handle that situation?
With the substantial coursework that comes along with a nursing degree, I found myself overwhelmed with my workload frequently in college. I found it best to create a schedule for myself to try to manage all the work I had to complete. What's most important, though, when it comes to an overwhelming workload, is to never sacrifice accuracy or quality in the work. As a potential nurse, I know how important that is. No matter how much work is expected of a nurse, a simple mistake while rushing could have disastrous consequences.
Describe a time when you were the leader of a group. How did you make sure your direction was clearly understood?
I'll go back to the end-of-year project I mentioned earlier. There was no technical group leader, but I definitely spearheaded our project. I found that timely and succinct communication was most helpful. I think that will translate well into a nursing environment. Timely and succinct communication usually results in effective communication, which is extremely necessary for the field of nursing.
Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. I am your nurse Fiona Jones here. How are you, Huston?
Good morning, nurse. I am good. Thank you for asking.
You seem to be upset. If you don't mind, may I know what's bothering you?
I am worried about my wound infection, nurse.
Thank you for sharing that. Your concern is quite reasonable. It is right, the wound infection will cause some pain and delay healing. However, the infection is minor, and there is nothing to be much alarmed.
Nurse, I'm anxious, whether it's possible that the tumor was malignant.
I can understand your anxiousness. A patient in your situation will definitely undergo such thoughts. Nevertheless, your surgery is successful and the large benign tumor was removed. The point to be noted is that a surgery will be done only after the bona fide diagnostics.
That's true. I admit that. However, how could you be so certain that the tumor was not malignant?
I can explain it to you, Heston. During the diagnosis stage you have undergone several examinations. Just try to recall those stages as I brief. Is it okay for you?
Yes, sure. I will try to recall as you say.
Good to hear that. Now, when you first meet the doctor for stomach pain, the doctor has done a physical examination on various parts of your stomach by applying pressure. It is to locate and calculate the tumor, or any bulgings present.
I see.
Alongside your previous medical history, Parental details collected are also part of the diagnosis.
Oh, is it?
Then various other tests, from blood samples to scanning, we have done our procedures one after the other, examining and eliminating the possibilities of several diseases, and thus, finally concluding the exact cause. Diagnosis is not completed by the finding. We will confirm the finding with the next test possible for the confirmation, in your case, biopsy.
All right.
Thus we conclude your cause of illness. Then start the next set of the process. Selection of the best possible treatment that can be provided for you. Hence, your treatment is finalized. This helps us to provide much accurate care for you. Hence, I can reassure you the certainty of the diagnosis process for your tumor. I hope this will help you to abolish the anxiousness in you.
Yes. It was very helpful for me to understand. Perhaps, I still have a concern that not all of the tumor mass was removed.
I acknowledge your concern, Huston. Like the diagnosis done to find out the tumor, we have done the tests to conclude the tumor has been removed completely. Only then we assure you that the surgery was successful. Or else, our conclusion might be another treatment option necessary for the cure.
All right. So you are conveying that my tumor has been removed completely and I'm safe.
Exactly, Huston. That's what the medical records convey.
I got it. But, how much longer I will need to stay in the hospital?
Even though the infection is minor, you may have to stay in the hospital until the infection is completely treated. And it might take 3 to 4 days more.
I see. I'm not feeling much comfortable.
Sorry to hear that, Huston. I can make yourself more comfortable.
Okay.
I can provide you with more pillows, which will allow you a much comfy feeling. Also, I can help you to make the bed readjust as you like.
That will be a great help, nurse.
My pleasure, Huston. May I know whether you are aware how to readjust your bed?
This hanging remote has the control for that. Isn't it?
Yes, you are right, Huston. Do you have any other questions for me?
Yes. I just want to make sure that, is there any possibility of the tumor reappearing?
Well, Huston, your question is sensible. Unfortunately, the possibility of having a tumor in the future is unpredictable. However, periodic checkups can eliminate the risk by early detection and treatment.
I understand that. How often the cyclic checkup should be done?
To be on the safer side, 3-month follow-up checkup is recommended.
Okay. I will follow that.
That's a good decision, Huston. May I know whether you need any more clarifications?
No. I'm satisfied with your explanations. Thank you very much.
I'm very glad to hear that. If you need any help, please ring the bell on your right side of the bed. Warmest wishes for a quick recovery.
Thank you, nurse. That is the end of your OET speaking session. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.